So when I sent out a little survey that some of you have answered to, we've got a little bit of a mix between people who are applying to medicine and people who are already medics or medical students. So what I thought would be really good is if we use the chat function to have a little bit of a brainstorm, think about what attributes you used when you were applying to medicine if you're a current medical student, or what attributes you would recommend to someone who's applying to medicine now. So I thought I'd break it down into personal, professional, clinical, and patient focused. And if we can think of these with like a little bit of a Marrow spin to them, sort of anything you think you've gained from volunteering with Marrow. And if you're a current medical student, just think back. And if you're applying to medicine, just think about all the things you've learned and just start popping them out in the chat. Sort of examples I sort of started to think of where personal things I learned from Marrow was confidence, organisation, leadership. So if you've got any more, just throw them in from any of the 4 categories into the chat, and then we'll have like a little bit of a discussion about how we actually use those things to help us when we apply for something. Yeah, teamwork was on my list as well. That's definitely one. Motivation again. Comms, that's a brilliant one. Fab, these are all wonderful. That confidentiality one's a really important one, as you all know. Yeah, that's great. Cool, yeah, that's excellent as well, adaptability. I'm just scribbling these all down so I remember them all. Yeah, that's brilliant, Anna. That's a really good point. It is, and it is something actually that we are obviously all quizzed about a lot on within medical school, and all of these things we have to do with our comms skills and things like that. So, you know, that's brilliant. So thinking about the things that we've just started to put out there, we've got a lot, and yet being easy and friendly, approachable, that's excellent too. So the thing with these sort of attributes is that all of them are really, really good. But what I found as someone that's interviewed for medical school and then actually been someone who interviewed prospective medical students is sometimes we sort of list our qualities and we don't actually talk about how we've developed them or sort of how they've come to help us in a thing. So I really like what you've started to go into there, where we're talking about using something to explain how we have, you know, gone about that. So if you can't all see the chat, Anna from Glasgow said, I think you can use explaining stem cell donation to potential signups as a way of showing that you can communicate and explain complicated things to people. This is really useful in future for explaining medical conditions to patients. So that's exactly what the crux of this talk is about, is that any skill that you develop through volunteering with Marrow, and we know how many there are, we need to be able to link to the thing that we want or the end goal. So for anyone in the room that's applying to medicine, you'll know that you've got coming up UCAS and then hopefully an interview. So going back to UCAS, you've got not very many words or characters at all. It's, I think it's a long time ago, but you know, within a couple of thousand characters. And if your school was anything like mine, they sort of didn't give you too much guidance of how to go about things. So we all tried to just squeeze as much in to our UCAS personal statements as we could, because you thought, right, if I just list everything that I'm great at, then people are gonna, you know, instantly want me at their university or want me at their medical school. But one thing I would say that's really important when applying to anything, but particularly applying to medicine, is quality over quantity. Because a lot of our medical students will have done very, very similar things. And especially going through the UK schooling system, we're sort of afforded the same opportunities with things like extended projects, Duke of Edinburgh, etc. So what we need to do, if you're thinking about applying to medicine and you're a Marrow volunteer, is think about how unique that is. Like, I'm sure lots of you, when you started university, had never heard of Marrow or Anthony Nolan, because it's not something that's commonly on everyone's radar. And I don't know how many of you at the moment speak to your consultants, your regs or your SHOs or F1s or whoever about your volunteering time. But I find I explain what the stem cell register is to basically a new person every week. And that's doctors in hospitals within the UK and then again over here in New Zealand. So what we've got is something that's really, really unique when applying to medicine and applying beyond medicine. So if we think about some of those skills, so you can write in your personal statement, I'm a team worker, and I guarantee that everyone else would have written, I'm a team worker. But if you were to say, through my time as a volunteer for Marrow or Anthony Nolan, and I always try when I talk about Marrow is just put the full charity name in there because it's a more household name than Marrow. For us, obviously, Marrow is the only household name, but it just means that we've got that kind of link to people who aren't in our direct Marrow bubble. So you kind of put it into a sentence and say, through my time volunteering with Anthony Nolan and Marrow, I was able to develop teamwork by working with a group of people to problem solve. So you're sort of tying two together and making it a nice sentence rather than I'm a team worker, I'm motivated, I'm good at communication, I'm good at problem solving. And those examples are definitely what sort of sticks in people's minds. So in terms of thinking back, anyone who's already a medical student, which I know we've got a lot in here, if you can think back to your sort of personal statement and writing it, can you remember at all like what the key themes were? Because I don't think mine was very good, is what I'm saying. So did any of you use volunteering in your sort of applications for medical school? Give me a little thumbs up on your things if you did. So it's a really, it's something that we all do when we apply for medical school, and that volunteering is often like, so I worked on or volunteered on a cancer ward, and I helped with sort of meal times and reading to patients and getting them some bits and pieces that they needed. But I think what's really, really unique about the Marrow application, the Marrow volunteering when we're using it in applications, is that we've got this sort of clinical knowledge and also this role that's really important. So when we've talked there, Joe has said about confidentiality and explaining complicated concepts. Those are things that we really are like, you know, doing every day in medicine as medical students, as doctors. And so it's really important to kind of tease out the skills from Marrow that are going to be really, really relevant and also put you just a little bit above all the other applicants, because reading personal statements for anything. So I applied for medical school, and then I applied for an intercalated degree, which you have to do a little personal statement for. And then I applied for my foundation year 2 job. So we split our scheme in Wales. So all the times I write a personal statement, I know that most people's personal statements are going to read pretty much the same. So you've really got to think about what sets you apart. And I think it's those more unique things that we need to be teasing out, like thinking about attention to detail, thinking about the fact that we have an understanding and appreciation of the confidentiality sort of legislation around signing people up, and also like the legal implications. And that just shows that you've thought a little bit more rather than saying, I can commit this time to volunteering and I can, you know, be a good team player, because those things are kind of generic for a lot of volunteering things. So your UCAS personal statement, I'd say you always want to try and mention Marrow if you can. try and get Anthony Nolan in there just because, like I said, it is the slightly more household name. So for people who aren't aware of what Anthony Nolan, of what Marrow does, will often have heard of Anthony Nolan. And then the best thing to do then is make the interview go your way. So my medical interview was very, very friendly, but I went to medical school in Wales, and everyone's very, very friendly. Again, when I interviewed for Cardiff Medical School as someone on the interview panel, I know that we really did our best to put people at ease. I'm aware that not all universities can be quite as friendly, and that's, you know, it's a job that people have got to do, and they've got to get lots of people through the interview process. So I do think that it's probably not to be taken personally if you didn't think that the interview was super friendly or it went really well. But what you can always do is start to bring the interview back to the things that you want to sell about yourself. So we've thought about all those amazing attributes, and we've got them in our UCAS personal statement, but it's going to be no good to us if we let the interviewer ask us question upon question without expanding on the things that we know we can sell. So when you're at your interview, for anyone who's interviewed for medical school knows that there's quite a few different formats of them, but what you want to be able to do is just answer the question in the way you want to answer the question and bring it into the things that you are trying to sell about yourself. So one of our interview questions, generic interview questions that we asked people was, give me an example of a time you were a team player. And lots of people will say, I played county cricket for 5 years, and I was always really, really, you know, part of the team. And that's great. And sports things are amazing, and they show, you know, great commitment, great dedication. But a lot of people are very sporty. A lot of people played on teams. So if you can say about your team working and pull Marrow into it, and you can answer a question in more of a way that says, when I began volunteering with the Anthony Nolan Stem Cell Register, which is a charity that signs people up to go on to donate their stem cells, I found that my team working skills developed because I was working with people from a range of different backgrounds, and we were all working towards a common goal. It helped us be able to problem solve, and we were able to demonstrate adaptability while all working towards this sort of end goal. And you can sort of see where the answers can go more your way with any question. And you've just got to think in your mind, pull it back to the example that you want to sell them. Because anyone can say that they're motivated or committed or a team player. But if you can give that example, it definitely sticks in people's minds a bit longer. So anytime that you want to bring it back to Marrow or volunteering, you can. And that also stands for anything you've done. So if people were to ask you a question about sort of your research interests, and you've done an extended project qualification, then that's when you talk about that. And all of us can talk about Marrow for so long. So it comes across with any Marrow that you meet, just like the passion that we have for what we do. And that is something that people will remember. If you are, you know, it's something that we're all giving up our own time to do. We've been doing for you know, some of us for less time, some of us for a really long time. And so that comes across really, really well when you see someone who you're interviewing and that they are excited about what they're telling you about. So for the next part of our session, it's more about applying after medicine. And I think our shift is definitely, we've got more current medical students here, but I just wanted to make sure that we were doing both sides of things, because that was what this workshop was designed to do. And also I thought it was really good because people who are current medical students you're nearer to the interview process than I am. So it's great to hear the things that you think that Marrow has helped you with in terms of personal skills and everything. So in terms of what people want to do after medicine, do people have specialties in mind if you're a current medical student? If you have, just pop it in the little chat thing there now. And I can start to tell you a little bit about what I know about those. So I work in peds, lovely, that's great, with Marrow as well, because of the it's brilliant, it's brilliant. So I am going to be applying for surgical training within the next couple of years, hopefully. And surgical training is a fairly well-structured application scheme, but not all application schemes are quite as well-structured. So the surgical training scheme gives you a really good breakdown of what you need for each section. But the other medical schemes, some of them can be a little bit more vague. You come with your own portfolio. They haven't necessarily given you the sort of strict structuring that the surgical specialty does. So if we go through some of these specialties in a whole, so peds, obviously that's excellent with Marrow, because a lot of our oncology patients are childhood cancers, and that's important because like a lot of our patient appeals have been with children, and there's definitely, you know, I find that the patient appeals with children, they get shared very well, and lots of people get behind them, and it's so difficult regardless of, you know, who we're doing a patient appeal for. But from personal experience, I would say people really get behind patient appeals with young children, and with the photos of sort of poorly kids, and peds is an amazing specialty. I've done quite a bit of peds surgery back in medical school, and it's great. So Rebecca, peds, very good. GP, so a couple of you have said GP, and that's another one that's great with Marrow, because we communicate so much. We explain, you know, a concept, like we said, that's quite complicated, but we also have that troubleshooting thing, which I found sometimes Marrow clinics could end up being a bit like if you were the resident, either medical student, or if you were the president or the donor workshop lead, that book of medical conditions, that's great for sort of your general knowledge and everything. Neuro-onc, obviously we're an oncology charity, so that's amazing. Cardiovascular, very good. I still sometimes can't read ECGs, and I've been a doctor for a little while now, so very impressed by that one. And oncology, yeah, perfect for Marrow. So the first thing you'll need when you're applying for training after you are graduated is your CV. So if you give me a little thumbs up, who keeps a CV, a medical CV? Good. Fab. I started my medical CV when I was back in probably third year of university, because I had a very good friend of mine who was applying for specialty training, and he said to us, he was like, gosh, I wish I'd started earlier. It's not impossible to do, but if you're trying to think back when you're postgraduate year 1 or 2 to all the amazing things you did as a medical student, it's a lot of time and hassle to do so. So start early with your CVs and start thinking about how you want to break your CV up and where we can fit Marrow into that. So what I can do, if you think it would be useful afterwards, is I can email round my CV. It's quite long because I've broken it up into lots of different sections, which sometimes can account for a little bit of repetition, but I think it's really good in the way that I've been shown how to do it and carried on doing it, to put your achievements in the right places so that people can scan quite quickly to what they are looking to find in your CV. So personal achievements is the first one I've put on there. So in terms of how to start with this, what I would do is sit down with your Marrow group and think about all the things you guys have done together. So back when I was in Cardiff still, we won some awards through our Students' Union, and then we won some AGM awards. So that's already 2 things that can go on as your personal statement, and you can put them as your own achievement because you were part of that committee, part of that volunteering group, or president, fundraising, whoever, who got that achievement. So on my CV, my personal achievements, I've got runner-up of Best Small Society at the Cardiff University Students' Union Guild of Societies Awards 2015. So for anyone who's involved in societies, you know, that makes sense. But anyone who isn't can get a quick read off that and know that we've won an award we were, when it was, who gave us that award, and what the award was. So think about all those things, because if you think about the times in an AGM or a conference where you've come runner-up or second, or your group was the best at fundraising, or your group got a special mention for fundraising, all of those things add up to another line on your CV. And there's a registrar I used to work with who's now a consultant in Merthyr Tydfil, and she used to say to me, whenever I mention something, she goes, another line on the CV, it's another line on the CV. And they can end up long. I think my CV is 8 pages long now. And I add to it probably once a month or so. I just sit down and think, what else have I done now that I can pop on the bottom of that CV? So personal achievements, you've got all your awards you will have won, things like lifetime achievement and top banana awards and anything like that can all go on there. And if you feel like at any point it's not clear to a un-Marrow trained eye what that award or achievement is, I recommend you just put a little line underneath in a sort of italic or smaller font, just a sentence to explain why that you won that award and what that means. Most of mine, I think, are very straightforward, but for the lifetime achievement one, I normally put in Lifetime Achievement Award, and then I put in the little blurb that comes underneath the Lifetime Achievement Award, which says, for commitment and time, dedicated to volunteering with Marrow. And then I always put the university-based branch of Anthony Nolan, because we just want to keep bringing that back to the household name of Anthony Nolan. So after personal achievements, I've got a section which is sort of extracurricular. And that's the time to do a timeline of the roles you've held within any committee position, and even any volunteering position. So the best way to do this, I find, is start right at the beginning. So my volunteering started with the NHS back in 2011 through to 2012. And then I started volunteering with Cardiff Marrow in 2012. And I held that through all the way to the end of me leaving uni. So even if you take up a committee position, you're still a volunteer. So you can put in that you're a volunteer for 5 years, and it looks really good, and it shows sort of commitment and dedication to that particular role. And then you can list your sort of committee roles or your roles outside of what you originally did with the volunteering as a separate thing. And then when you graduate and you come and join Marrow alumni, you become a Marrow alumni member, and you can still consider yourself to be a Marrow alumni volunteer, because anything we do, like even when you just share something for Marrow alumni, you're still part of the Marrow alumni family, and you're still sharing, you're still volunteering and everything. So it doesn't stop when university stops. Marrow keeps going. Some of us can't let go. So we can definitely still use it to our advantage long after you graduate. So the next thing to think about is your portfolio. So give me a little thumbs if you started making a portfolio. Very good, very good. So my plan was to show you my portfolio, but in the Holiday Inn just outside of the Heathrow Airport, I realised I was over my baggage allowance and I had to dismantle the thing, and it's not been put back together yet. So my portfolio was basically started the same time I started putting my medical CV together. And for those of you who aren't making a portfolio yet, at least just keep saving certificates. Anytime you get a certificate that is awarded to your Marrow group, photocopy it in colour and keep a copy for yourself. And anytime you get something on social media, like the Top Banana things, or the Marrow team have shouted you out, you can ask the lovely guys at the Marrow team for something a little bit more official for your portfolio. So as far as I'm aware, they do use a standard template, which is a sort of letter that says, Lily volunteered with Cardiff Marrow from here to here and Marrow alumni from here to here. She held roles which included this, and this. And it's just proof that you've done what you're saying. A portfolio station at an interview is basically you sat with one person ahead of you who will ask questions on your portfolio, and one person who just checks your portfolio matches up to what you've said it does. Because obviously applying for any specialty training, you tell them what you've got, and then you can't really evidence it until you get into the interview. The UK is a little bit more old school with applying for things. I'm looking at applying to surgical training in New Zealand, and they use an electronic portfolio, which makes sense. But the UK, especially for surgical training, for radiology training, and I want to say for medical training, definitely at the moment, are still using a paper-based portfolio. So just keep collecting things. Even if you're not putting it in order yet, just get it into a box or a folder or something. And then the other thing to think about doing with your portfolio is double saving things on your computer. Because especially for anyone who's still a medical student, not yet graduated, I hope one day they'll turn over to electronic portfolios. So just put things in folders on your laptop. I've got a little subsection which says portfolio. And if I get a physical certificate, I use one of the apps on my phone, like Cam Scanner or something, which just converts it to a PDF so you can put it online. And that's just like a good way of making sure nothing goes wrong with it as well. I worry about things a lot. So for example, when I was writing my dissertation, I had it saved in about 20 different places, and I would email it to myself every day. So just having your stuff in a paper portfolio, even though a lot of specialties will ask for a paper portfolio, is risky. So anything you're doing, and often we only do get a paper certificate from our Marrow achievements, just scan it in and keep it somewhere a bit safer. So what kind of things would you think go into portfolio set headings? So some of you will know this, but if you could just throw into the chat, or if you're not muted, you can shout them out. What kind of headings there are in a portfolio when applying for specialty training, or subsections to divide your things into. I'll start you off. So the first one that I think that Marrow's applicable to is leadership. So if you've ever tried to evidence leadership, it's not always that easy. So within the surgical training portfolio, there's a section that says demonstration or holding a national leadership role for however long, and you can score more points if that is related to medicine. So while we often like to sell that Marrow isn't only for medics, this is a time when we can sort of use it to our advantage and say, I was the president of this group, which is a group that is related to medicine, and you held that leadership role for a year. And that was when I was saying that you can get a letter from either your students' union or from one of the guys in the Marrow team to put in your portfolio. So leadership's one. Evidence of teaching skills is another portfolio section. So a lot of you, I suppose, will be doing teaching, like near peer teaching and things like that with your sort of medical students that may be a couple of years below you. Or if you're a medical student that's quite new, you get a lot of teaching from F1s and F2s and junior regs. So teaching is something that medical education is so important, and they're really keen on it. But it can be sometimes a little bit hard to organise a session. But we teach new volunteers how to volunteer all the time. And going back to the things you said to us earlier, like when you're doing those teaching sessions, we think about confidentiality and explaining concepts, and we're physically teaching someone how to swap, which isn't obviously the most difficult. Those of you who were back in the spit times know that that was sometimes challenging because people got it everywhere. But we're still teaching someone a skill that is medically oriented skill. We're doing it for a range of sessions. And what you can start to do is get your fellow committee members to give you feedback on how you taught. So when I do a teaching session for anyone, so I've got one, for example, this afternoon with the basically anyone in medicine who wants to come to our teaching session today and work can do. And we start by always giving out a sign-up sheet, which you do every time you have a sign-up session. And then we get feedback at the end. And that's evidence that you've done that teaching. So you're always going to have a sign-up session whenever you're training new volunteers. And if you could get someone at the end just to say, hey, like, how did you think that was? Could you give me any advice on like how I taught things? Then you've got feedback. So without even having to organize anything yourself, you've led a teaching session for a charity. And as soon as you start saying, you know, throughout medical school, every month or every term, I led teaching sessions on how to sign people up to join the stem cell register to go on to donate their stem cells. That automatically sounds like you know a lot what you're talking about and that you've done something that's really, really stand out against lots of people who will say, I ran a session of small group teaching on clinical skills while I was a medical student, and I have this feedback to evidence it. It's always bringing in like that little bit of passion and energy that Marrowers have about Marrow, because we love Marrow and we can't get enough of it. The other portfolio things to think about are when you're going for any positions that have a portfolio that's a little bit less structured, you can put in all the personal achievements there. So I always throw in the Lifetime Achievement Award. That's something that I was like super shocked and thrilled to receive. And so it's something I always want to shout about, because like, it's so nice what we do and we love what we do. But like when you get a recognition like that, it's really good to sell that to other people. And it sounds cool. And like people want to know more about what you do, and people want to know, you know, how you came to get that award and sort of how you managed to, you know, juggle your time and everything. So the portfolio session or station in any interview relies on you having a decent portfolio. You don't have to go quite as fancy as Dr. William Lawson, who has got his folder printed. People will turn up to interviews with portfolios that will make you feel really bad about yourself. They'll come in with these giant embossed leather-bound things. A simple, well-organized portfolio is enough. There's a set of file dividers on Amazon, which are super organized. I use them, and you can put in all the sections, and you can put in little sticky notes. Or another trick that you can do with a portfolio is, if you've got something that you want someone to flick onto, put a piece of card behind that bit in your portfolio. So all of the boring stuff that you sort of know that everyone will have, like your medical degree, chuck that in there, everyone's got one. But if you've done something, Marrow or otherwise, that you think is like, yeah, I want people to know about that, put a little bit of card in behind that sheet, and it will automatically stop there. And when they're flicking through it, they'll stop at that thicker piece of card. That's a good one for like dragging people to what you want. And like we said with the interview, if you're applying for medical school, your CV, your portfolio, anything can be the best thing in the world. But if you don't sell yourself, then you're not going to get the opportunities that you want necessarily. So advice for portfolio would be, start looking now, start saving things. If your friends are anything like mine, they'll rinse you for it, and they'll be like, oh my gosh, you're too keen, you're spending too much time doing all of this stuff. But I can promise you it makes it so worth it when you get to come into your interview and you've got a really well organised portfolio. Which drags us on nicely to interview. So is there any particular skills you would think from volunteering with Marrow that would help you with the specialty that you have just mentioned to me on the chat? So if you're not sure what you want to apply for, just go back again and we'll think about the slight difference in applying for medical school to applying for specialty training. So just in the chat, start putting out some sort of descriptions and words and characteristics and attributes that you have developed, which you think would make you eligible for further training or postgraduate stuff. Some of them will be the same, but I think some of them might come out to be a little bit different. I've woken up very early for this, so I've got to have something. Lovely, thank you. So yeah, confidence, especially in talking to new people. And that links back to the one we said earlier about being easy to chat with and being friendly and approachable. So in terms of applying for specialty training or postgraduate training, you're taking you're always taking a higher role whenever you go through your medical career. So if you can say, through my volunteering with Marrow and Anthony Nolan, I developed confidence in communicating with new people, and I think this will be really beneficial in a role where I will be working with new teams and as a more senior member of the team. Resilience is a great one, and that's something that we don't necessarily always think of when we're applying to medical school, but it is something that we need to be able to demonstrate when we're applying for specialty training, especially for some of the more typically difficult, in terms of emotionally difficult specialties. You know, you're always going to have busy times in whatever job you go into as a doctor, but thinking about things like peds can be difficult, oncology can be very difficult, psych can be very difficult. You can say you've developed the resilience from standing in the rain for hours and not giving up. And also sometimes the patient appeals can really help with building your sort of resilience, and you've got to be able to sometimes be like mind over matter focused and pop your kind of emotions about the situation just to the back a little bit while you're focused on running a clinic, because we've got to always be the right balance between professional and making sure that we're sort of letting everyone know all the correct details, even when we've got a goal in mind. Particularly, I think, some of the patient campaigns we ran out of Cardiff back when I was volunteering, we were doing patient campaigns for people we knew, students at Cardiff University. And that can be like a really emotionally charged situation if you're out on a clinic and you're trying to sign people up and you know the person that you're doing an appeal for. So you can talk about your resilience in that situation, and also about your ability to park things and be professional and keep going through a difficult time, and knowing that you've been able to continue to turn up and show up and everything, whatever, when things are getting a little bit trickier. Time management skills are great for the further you get through medicine. So, for example, when you're an F1 or an F2, you're mostly ward-based for the most part of it. So you work on your time management skills in terms of, knowing that you've got this many jobs to do and you need to get them done by this time. But as you go further on, so my role now, I start at about 7:30, 8 most mornings. I do a ward round. I'm either needed in clinic or I go to theatre, but I also have the ward to look after. And I've also got patients to have discussions with. And I've also got nurses who need me to answer questions. So time management's an excellent one. And I don't know if you guys are similar to me, where you have like a little Marrow admin sesh and then you might do a little bit each day, or you might do one big session, but it's definitely something we learn with Marrow. Emily from Leeds, that's brilliant with the asking for help, because awareness of your own limitations is so key in medicine. And it's something that I am noticing a little bit with some of the doctors that I'm working with over here. They're very like, I can do this on my own, I'm fine. Whereas I think we work in a really nice culture back in the UK where people do ask for help. And by the other side, you can sell in an interview for specialty training that as the president of so-and-so Marrow, or as the donor recruitment lead of so-and-so Marrow, I was often faced with people troubleshooting with me and asking for help. And I was able to, answer these questions or assure the people if I didn't know the questions, I would get back to them. And that's a really good one. And awareness of your limitations is so important and comes across like really mature in an interview, because lots of people aren't aware of their limitations. And I'm never afraid to ask for help. And especially, if you're applying for a CT1 post, a first couple of levels of training, you need to be able to know when you're going to ask for help, and you can use those examples to sort of link back to that. So my take homes from this bit are probably start with your CV and your portfolio and get it going now, because you will thank yourself in years to come when it's all ready to go. If any of you are planning on spending some time abroad, which I cannot recommend enough, all the application systems are slightly different, but for the New Zealand one and the Australia one, they focus more on a CV than sort of like a generic application scheme like we're used to in the UK. So you need to send them a CV that is better than all the other doctors who are sending in CVs. So it's like the best thing being over here and working over here, but the application for it can be a little bit different to what we're used to. So if you've got that CV ready to go, then that's one thing ticked off your list of like applying for jobs abroad. And if anyone separately wants to message me, and even in years to come, and talk about applying to work abroad, like I couldn't recommend it enough, doing some medicine overseas. And if you've got like electives coming up and everything, I'm more than happy to give advice on that, because that was like the best part of medical school. So I will wrap it up very shortly, because I know it's been quite a lot of me talking at you a bit, but I thought it was good to just go through the things that I've learned and get like a little bit of a feel for the things that you guys are picking up. But a lot of this is from my personal experience, and anyone you'd speak to would have slightly different. So this talk would never be done quite the same by two different people. But this little slogan is something that I actually got an article published in a magazine a couple of years ago about how we so often say, oh, been there, done that, got the t-shirt being the phrase, but we got nothing but the t-shirt. And all of us have got Marrow t-shirts coming out of our ears, but we don't always sell what we've done. So your options are a list of experiences or skills that you've learned. I'm hardworking, I'm confident, I'm a good communicator. No, they make such boring reading. They get lost into, a pile of everyone who's done the same. A really well-structured paragraph's explanation of the ways you've developed skills or experiences through an opportunity, Marrow or anything else, and how they make you suitable for the role that you're applying for. So anytime that you're applying for a role in the UK, it's a bit more structured. If you're applying for roles sort of out of training, so for example, any of you thinking of taking an F3 year and locuming a bit and earning some money or getting some experience in clinical fellow posts, you'll end up writing cover letters. I wrote a cover letter for my application to both New Zealand and Australia. I applied to both. And that's the bit where you can sort of sell yourself a little bit more. And you just need to say, like, anytime you're thinking about writing something, it's just always link it back to I did this and I learned this through doing this, and it has made me this. So I can't stress enough how much I've read so many CVs that can be very listy, or cover letters or personal statements that can be very listy. But when you've got like a sentence that talks about your experience, that you can sell your passion a little bit in, that you tie a few skills together in, you make it a much more interesting read. So I think my application for F2 was, again, like a word limit thing. But I spoke about Marrow for probably a good paragraph at the end. And I tied in basically everything I wanted out of it. So I spoke about how long I've been doing Marrow, because you can show that your time commitments and your dedication from there. So I said I've been doing Marrow for this many years. The roles I'd held, I said a variety of roles, including, and then you put the one that you want to sell at that time. So I'd said, including president. And through this, I have developed skills in, and then like do a couple of there. And then you say, I feel that these have helped me develop as a doctor because. So you're just kind of always putting lots of things that you want into the sentence. And sometimes you can feel like it can get a bit run on, but just get a personal statement out there and then start trimming it down afterwards, because you'll realize how much more you've got out of Marrow for applying to medicine that you thought, or applying after medicine than you thought, when you actually start to think about it in a bit more detail. So that's probably me. If anyone's got any questions in the chat or anything, then feel free to chuck them on there. If anyone wants to email me or message me separately, you can always add me on Facebook, but I'm not that good on my Facebook. But I'll put my email address on the chat now, which is one of the anti-Nolan ones. So you can ping me emails about applying for specialty training, about any of the opportunities I've had throughout medical school and beyond. And like, I'm really, really passionate about medical education and about mentorship and everything as well. So if any of you are thinking of applying for anything and you want just some help or some advice, I would be keen to help. And I've also got a group of the alumni lot who are in different specialties. So if you're not in these groups yet, that might be fair enough, because you're not quite alumni, but there's no harm in joining early. The alumni community groups are really good ones as well, because if you were interested, I could find someone to put you in touch with who is doing the specialty that you want to do. So yes, Lucy, I would. So I put my volunteering that is relevant on my CV. So I put in the cancer ward volunteering. So for anyone who's not got the chat open, Lucy's just asked, would you put any volunteering that you did before medical school in your CV? And yeah, if it's relevant to being a doctor, then absolutely go for it. If it's a bit more niche, so like, for example, I volunteered at a cancer ward, but I also volunteered at a children's centre reading. Like, for me, not as relevant, but if you were going for peds, it would be relevant. So I just think about what exactly it is. Stuff like working in a charity shop is always good, but if it's like really not related to medicine at all, you might nip that one off for when you're applying for postgrad stuff. Yeah, so what I was just saying then was, what we can do is put you in touch with anyone doing your specialty, if you are thinking of applying, who's in that specialty, which is something we're looking to do with alumni. I decided to apply to New Zealand because I always knew I wanted to take a year out of medicine, or a couple of years out of medicine. It's a very different healthcare system in terms of how they treat and look after doctors. I adored working for the NHS, and I loved my 2 years in Cardiff and living in Cardiff, but the quality of life here is so different. Just little things like the opportunities I get. I can do a lot more in theatre. Even as simple as like, I get free food every day that I'm in work, and if I work overtime, they pay you your overtime, and if you are cross-covering. They pay you for cross-cover, and I don't work weekends, and I get to go explore beautiful places on my weekends off. And I live in a lovely little house on the river that is much cheaper rent. So there was a few things that sort of made me want to apply to New Zealand, but it's a great opportunity, New Zealand and Australia. And I'm very, very lucky at the moment that we're in alert level 1 with very minimal cases of community transmission. And every time I think about you guys back home, I just wish that I could wish you all over, because I've got so many friends and family who are still back in the UK, and I know things are getting a little bit tougher again, but Marrowers are resilient and great, and we will all get through whatever comes next. So please do follow us all on alumni, because you'll become alumni eventually, and it's a really great community. And I left Marrow when I graduated, and I spent a couple of years not marrowing because I was working and finding my feet as a doctor. And now that I'm a bit more settled and I'm in a bit more of a sort of senior role where I can manage my own time a bit more, I do still have people to answer to, of course, but I'm not as busy as I was on the ground. So I decided to get re-involved with Marrow alumni, and that's something we're finding lots of people are doing. So like our pages and join our groups early, and if you take a couple of years out from Marrow, that's fine, because you'll always come back. I'm going to head off because I've got to go to work, which I would love to stay and chat to everyone all day. I really hope that was useful. It's something that I wanted to be able to do, and we spoke a lot about in our planning. So, thank you guys. Thank you. I'm really glad. And if you want me to send over notes or anything, then I can do. And honestly, just chuck me an email on the alumni comms one, or I'm always on all the alumni social media. So just send me a message, and we can chat about anything, honestly, because I would love to help you all. And just well done on being fab Marrowers, because you're all great. And Hannah, I will reply to your message this afternoon. All right, have a lovely evening, guys.
Hope works all right. Bye.